Welcome back to another episode all. Before we move on, please subscribe as it will help spread the message. In this episode I'm going to talk about the NHS in the UK, including my own experiences. To begin, the NHS is very understaffed, underfunded and low on resources, which cause numerous problems. By being so low on staff but having numerous patients, the patients receiving help are delayed as there's not enough doctors, nurses, paramedics nor surgeons. High demand and low supply always causes problems to people, in this case the NHS. I would just like to discuss accident and emergency now, A&D. A&D is facing so many issues. In my local A&E, approximately 25% of people who attend A&E don't need to be there. About 25% adds more work for the emergency department to deal with, and delays progress and losing space. A&E should always be our final option if we are not facing life-threatening situations. Each time I find myself facing a health problem, I try other services such as walk-in centres, GPs, minor injury units and the urgent care units, and if none of those are able to, I contact the non-emergency services. If I ever feel a circumstance that makes me feel the need to attend A&E, I find confirmation first, whether it's calling the non-emergency services or just asking a family member. If people need to go to A&E, they should have someone take them instead of calling for an ambulance. They could always call for an ambulance on the way to A&E if they need to. If the situation is not life-threatening, the person can attend an urgent treatment centre. If someone goes to A&E for a severe injury, they'll be waiting for, on average, about 12 hours. You should only go to A&E if you're having signs of a heart attack, such as chest pain, pressure, heaviness, tightness or squeezing across the chest. Second, signs of a stroke, such as face dropping on one side, cannot hold both arms up or difficulty speaking. If you have sudden confusion, such as cannot be sure of one's own name or age. If you attempt suicide by taking something or self-harming. If you have a severe difficulty breathing, such as not being able to get words out, choking or gasping. If you are choking on liquids or solids right now. If you are bleeding heavily, spraying, pouring or enough to make a puddle. If you have any severe injuries after a serious accident or assault. If you have a seizure or fit, such as shaking or jerking because of a fit, or unconscious and cannot be woken up. If something happens sudden, rapid swelling, whether it's of the lips, mouth, throat or tongue. If you're not facing any of those circumstances, try all alternative services first. All patients are assessed by a doctor or nurse before any treatment takes place. This is called triage and helps the staff decide what order to see the patients in. So they see the most urgent emergencies and situations first. A&D doesn't work as there first, served first. What happens next depends on the results of their assessment. If they are seriously unwell, they'll be seen by an A&D doctor and referred to a specialist unit or admitted to a ward if necessary. If you do not need to be seen in A&D, you might be sent to an urgent treatment centre or referred to a GP on site. In other situations, they might be asked to make an appointment with their GP surgery to request a GP referral. Some people will be given a prescription and sent home, with instructions on what to do next. If they are registered with one, their GP surgery will be contacted afterwards with an update on why they went to A&E and any treatment they got while there. In my experiences, Most times I've attended A&E has been because of seizures. If the seizure results in something we don't recognise or understand. Like after some seizures, I've lost the ability to walk. So we called A&E as we didn't understand why I couldn't walk. As another example, I thought I experienced rectal bleeding several days in a row, which could cause bowel cancer if not addressed soon enough. I went to make an appointment with my GP, as the NHS website suggests, but the earliest appointment would take 6 weeks because I've been so understaffed, which was too long. So I went to A&E, which checked things, and it was a good job they did, as it wasn't rectal bleeding, but I had an infection. I couldn't sense it because I am insensitive to physical pain due to my autism. The doctors then made plans, sent me home instructing me to contact my GP to tell him what the doctors at A&E said needs to be done to heal the infection as soon as possible. Notice how I would have had to wait 6 weeks due to health centres understaffed, but there were not enough appointment spaces left. During my time in the A&E, it was disappointing so many people are so ungrateful and disrespectful towards doctors and nurses just because of the waiting time. In A&E, so much is to be done behind the scenes out of public sight and is private and confidential information. The NHS staff are working for about 12 hours per shift, which will be exhausting, I am sure. We should be appreciative and grateful for their service if we are not in the most severe of situations. Now I'd just like to talk about ambulances for a bit. Here in the UK, 10.6 million emergency calls were answered in 2022 to 2023, which is 2.6 million more than the previous 2 years. Reports have consistently highlighted severe ambulance delays. Patient safety is being compromised. Some people have died as a result. Among ambulance staff, morale is at an all-time low. Sickness and absence rates are the highest and show the highest rate of increase of all NHS organisations. Ambulance jobs have been shown to be highly demanding and come with significant performance pressures. There is also a lack of career and development opportunities. Paramedics speak of how low job satisfaction is and their poor mental health because of it, related to insufficient pay, stressful working conditions and intense workloads. Given the record numbers leaving for less stressful and better paid jobs elsewhere. In January 2023, the government announced its NHS recovery plan. This plan is predicated on having more staff, yet does not adequately address how to improve recruiting and retaining. Ambulance services have struggled with historical levels of underfunding. The latest demand and capacity review forecasts an annual funding gap of £237.5 million. Pressures of meeting the increase in emergency call demand have been again highlighted by Parliament and experts. In 2022 to 2023, 1 in 4 ambulances is experiencing delays of more than 30 minutes, which is twice as long as the standard for handover time from ambulance to hospital. These delays are having a disastrous impact. During my last time in A&E, I heard the receptionist tell a patient complaining about waiting times that there were 70 patients in A&E and 13 ambulances waiting to hand over patients out back. The last time I was taken to hospital by ambulance services, it took over 1 hour to arrive at my home, and once we got to hospital, the 2 paramedics had to stay with me for over half an hour until a space in A&E became available. Several causes have been identified, including insufficient hospital beds and low patient flow, meaning more people getting stuck in the system and not moving through efficiently, low supplies and low on resources. Further, The emergency system has been found to be highly risk averse, meaning more ambulances are sent out than should be. Patients struggle to access the care they need in the community, which also results in more heading to A&E or calling the emergency line. The continuing and unhealthy focus on performance targets has resulted in negative outcomes for both patient care and workforce morale. Everyone from the NHS and ambulance trusts to paramedics, policymakers, academics, and the public needs to work together to create a modern emergency services that is fit for purpose. I asked the paramedics on the way to hospital if they had fewer staff on that night. They told me Fridays and Saturdays are their nightmares because of drug abuse and physical abuse causing emergencies are more frequent. When it comes to being an outpatient, such as I've been an outpatient for my epilepsy checkups, if people receive any outpatient appointments, it's important people either attend their appointment or cancel the appointment, as missed appointments cost the NHS about £200 each. When it comes to surgeries and treatments, the first thing to note is there are always risks, potential side effects, and the possibility of being harmed. What's important here is informed consent. For something to be informed consent, it first of all must be done voluntarily. Secondly, people must be given enough information to be able to make a balanced decision of whether to take the risk of surgery or not, such as the potential benefits and the possible consequences of not taking the treatment or surgery. And finally, the patient must understand the information they have been given. If they don't understand the information, they are not actually informed, as they don't even know what they've been told. It's also important for patients to ask questions, as the doctors don't know how much the patient knows. I was offered brain surgery for my epilepsy, but once I asked my questions, I decided to decline the surgery, as the risks were not worth taking from my view. Such as one of my questions was, have you ever done this to an autistic person, someone with a brain that functions in a different way? As most research is done on typical brains, and the answer was no. So I was part of an experiment, and I said, no, I'm not taking that then. Some of the potential side effects would have been things like having persistent strokes, getting a heart infection, forgetting everything I'd learned over the last 10 years, forgetting what my own family looks like, my family and friends. I would no longer be able to walk. I would have to stay in full-time residential care, meaning I would have no independence whatsoever. So I thought that wasn't worth it. So I declined the surgery I did by gathering information which I wanted, as the doctors didn't tell me all of that information. So if you ever are going to go for surgery, make sure you ask questions, to gather as much information about the surgery you can. Concerning medical negligence, the only time when the NHS should be held responsible for harming patients is if the members of staff themselves, the doctors or nurses or surgeons, did the job recklessly. What you've got to remember is that all the treatments, surgeries, medications in the NHS are approved by scientists, made by scientists. It's the scientists who went saying that it is safe to do this surgery, it is safe to consume this medication. So the only time the NHS should be held responsible and charged for medical negligence is if they were just doing their job recklessly and not following what they were educated to do and just being careless. As a couple of examples, at one time when I went to see my GP, he decided to prescribe me penicillin, but it was written right in front of him on his own computer that penicillin is my allergy. So if I didn't know my allergies, I would have consumed that which I'm allergic to. So that was just a GP being reckless at his job. He wasn't doing a very good job there. And there's someone else out there apparently got discharged from hospital when she shouldn't have been, sir. And the reason why they discharged her, it was all because of they didn't have enough beds for other emergencies which were coming, showing just how low on supplies and resources our NHS in the UK are, and so on. And then someone made a complaint about it, and I would actually say that the man who made a complaint, it was a valid reason to do so, as the situation that this person's in is greatly severe, and that if I were a doctor, I wouldn't have discharged this person who had to go to hospital. This person needed a treatment herself, she did, but they still discharged her from the hospital, but eventually she got to go back in the next day after the man made the complaint, and by doing so, she was welcomed back into the hospital, which I would say shows that there are some members of staff in the NHS who are reckless, so at times they should be held responsible for patients getting harmed. But there's also, most of them in my experience, have been very significant and satisfying at their job. Such as, I can only recall the one time concerning prescribing me my allergies. That's the only time I can prescribe them being reckless towards me. And from what I see going in A&D, the times I've been there, it's all very satisfying in my experience. But every group's got its mould, so there will be some staff who do not follow the education, who do not follow the procedures correctly for any kind of treatment. And when it comes to diagnosis, so if it's something like a misdiagnosis, you've got the field of psychiatry to blame there, and you've actually got the scientists to blame again, as they've created numerous different diagnoses, and ones which are just general human experiences are now classified as medical disorders altogether. Such as if you get anxious and then you're feeling too anxious, if you just go see your GP or any kind of doctor, they may just diagnose you, claim that you've got an anxiety disorder. If you're experiencing major depression, they'll say you've got major depression disorder or some other kind of depression disorder, so that they can prescribe drugs to you. As that's basically what psychiatry has made it. It's more of a marketing plot now. They just want to sell disorders to people so that they can sell interventions, sell drugs, and so on. Such as how many disorders exist wouldn't go from approximately 60 in 1952 to over 300 in 2013. It wouldn't increase that much. So clearly all the disorders are just being made so they can sell drugs. Like, out of all the psychiatrists I've listened to online, ones who actually are qualified psychiatrists, claim that 70% of the US, of the United States, are on antidepressants, that more people die of prescriptive drugs than they do drug abuse. About 25% of the US are on psychiatric pills. So that to me sounds like something's just so wrong there. Such as when my parents and their generation, my grandparents, when all of them were children, we didn't have so many people on this many drugs, but doctors were not going and diagnosing people with things like just general anxiety as an anxiety disorder. So I could safely say that's why the older generations don't have as many people diagnosed with medical disorders. So we've actually got the scientists to blame there concerning misdiagnosis and diagnosis. Like a lot of people who are autistic, for example, get misdiagnosed with ADHD, but that's due to the scientists making numerous overlapping symptoms between numerous so-called disorders altogether. So, if you've made it this far, thank you for listening, and please be more understanding of the emergency services of our NHS in the UK, and please may help spread this message, not just for the NHS's benefit, but for everyone's benefit, so that ambulances may be able to get to emergencies sooner, such as I've got so many friends who've had experiences where it took like 2.5 hours before the ambulance was able to get there. And as it said, 25%, 1/4, 1 in 4 ambulances are not able to arrive on time. So please help spread this message, and please keep your responsibility on which department should you attend if you ever experience health problems. Thank you for listening.